Flexible sigmoidoscopy involves looking at the inside of the rectum and lower part of the colon through a flexible tube called a sigmoidoscope. The doctor can look at the lower bowel to see if there are any abnormal growths. Sigmoidoscopy, like all screening tests other than the stool test for blood, requires that the bowel be cleaned out before the test. Different kinds of preparation are used to clean the bowel for the test, and you can expect to spend some time in the bathroom.
Typically, the night before, the patient takes an enema or a strong laxative to get rid of all of the bowel contents.
The preparation for the procedure was easy, and it wasn't really bad. I just had to take an enema.
A sigmoidoscopy can be done in a doctor's office or hospital. Air is gently pumped into the bowel to expand it. A sigmoidoscopy doesn't usually require sedation, which is a medication to relax you and dull the pain.
The doctor had me up on the table and he told me to lie on my left side, I believe, and then he began the procedure. I didn't have to take the anesthesia, and I watched it on the screen, and that was it. It was very simple.
However, some people experience some pain or discomfort.
It was uncomfortable. There was no sedation. All of the air that had been pumped into the intestine during the procedure gave you a feeling of being bloated and uncomfortable.
After the test is done, and it typically takes only about 10 minutes, patients are able to leave on their own and drive home by themselves.
After the procedure was over, I didn't have any discomfort or any ill feelings or anything.
My feeling about having a sigmoidoscopy was that the prep was a nuisance and cumbersome, with some anxiety about getting to the bathroom in time, that the procedure itself didn't last a long time, but that it did have some pain associated with it. But despite these negatives, that the experience was worth it to have peace of mind.
Some people feel that it's a disadvantage that flexible sigmoidoscopy only looks at the lower part of the colon. However, studies have shown that all the screening tests, if done on the recommended schedule over a period of years, are effective at preventing colon cancer deaths. Sigmoidoscopy has few risks. There's a very low risk of bleeding in the bowel, but the bleeding is usually not serious. In very uncommon cases, about 1 in 10,000 exams, the bowel is punctured by the sigmoidoscope and may need to be repaired surgically. If no abnormal growths are found, it is recommended that a sigmoidoscopy be done every 5 years. In about 20 out of 100 people, abnormal growths are found. A colonoscopy will be recommended as a follow-up exam, and the growths can be removed for further testing.